A title: Cognitive Capacity. A disclaimer: the opinions, findings, conclusions, and recommendations expressed in this program are those of the speakers and do not necessarily reflect the views of the U.S. Department of Justice. This project was supported by the U.S. Department of Justice's Elder Justice Initiative and the Office on Violence Against Women. Portions of this program are protected by copyright. If you would like to copy, display in a public setting, adapt, or distribute this program, please contact elder.justice@usdoj.gov. Dr. Harry E. Morgan, President, the Center for Geriatric and Family Psychiatry, Glastonbury, Connecticut.
Capacity, by definition, is your ability to do something, essentially. You could almost substitute the word ability. Functional ability is the term I use. So you can have functional ability to do arithmetic, but not necessarily language. You could have functional ability not to organize certain things, but to be able to organize other things. When we talk about capacity in a legal sense, it really is saying in an area of question, do you have the abilities to transact that area legally capably? So you can certainly be incapable of managing your finances and yet capable of making medical decisions about yourself. You could be able to make decisions about some aspects of your finances and yet not others. That obviously also has to do with the complexity of the decision at hand. The more complex the decision, the higher the degree of functional capacity necessary.
The interviewer.
And what then is financial capacity?
Financial capacity would by definition be your ability to pay your monthly bills, to organize your income, to make sure that you don't put yourself at jeopardy by not attending to those things. It can also be, do you have the awareness to know when someone is taking advantage of you? Are they absconding with your money? Some people are so impaired that a telephone call will let them give out financial information. So judgment, even mildly impaired to that degree, can be really risky and may, in fact, put the person at a great deal of financial risk. Medical consent is the underpinning of your ability to make decisions for yourself around medical procedures or medicines, anything in the field. You really have to be able to understand what's being proposed, how it would impact you, and therefore what the side effects could be, what your benefits are relatively, and then to be able to make a decision consistent with your wishes. There can be a breakdown anywhere along the way with that, and it becomes important for many older people to be clear where there's a breakdown, or not to be biased that because they're older, there has to be a breakdown. There are many very aged people who appear quite frail and are absolutely capable of making their own decisions.
And how about the ability to consent to sexual activity?
Relationships are so important. There are different levels of relationships. Sexual activity is the most intimate and the most personal. The development of a relationship that can lead to sexual activity is full of all kinds of irrational, unconscious choices. And that's not the same as incapacity. When a person is incapable, they may not be able to withstand, they may not be able to say no if they wish to be no as the answer, or they may say yes to everybody. We will see this in dementia, in nursing homes, for instance. If someone is able to be hit upon by all the men on the unit, they're not really capably understanding this, unless that's consistent with their life. More typically, people have to have the ability to understand, again, the nature of this relationship, the desire for more intimacy, and the consistency between relationships. Sexual abuse occurs frequently among older people when they don't have the ability to have someone watching over them, if they have infirm abilities and they live with people with other significant emotional illness or in settings where they are vulnerable to other more violent individuals.
Karen Tyfor, Case Manager, Geriatric Regional Assessment Team, Evergreen Health, Seattle, Washington.
Whether someone has capacity is really influenced by two things. Number one is the significance of the decision, and number two is the cognitive capacity, the cognitive skills involved in the capacity of making that decision. So these are directly related. If the decision is more complex or more serious, having a greater impact on the person, that's going to require a greater degree of capacity than if it's like buying something in the grocery store. What capacity is not, it's not absolute. It's not that someone does have capacity or doesn't have capacity. It's relative to the decision being considered at the time. And it's also not related to a diagnosis. Just because someone has a diagnosis of dementia or Alzheimer's disease doesn't mean that they don't have capacity to make decisions. It all depends on what their cognitive skills and abilities are to be able to understand and analyze information and make the decision. That's the question of this particular decision. Like, someone may be able to make the decision to have someone handle their money for them. They may not be able to make the decision to sign a mortgage contract or to sell their home. It's also not related to IQ. Someone who is very intelligent may not be able to utilize that intelligence because some of the other cognitive abilities are impaired. Someone who has a developmental disability may have the capacity to make a lot of more decisions because they are able to understand the information and analyze it and make a decision.
If a prosecutor gets a case involving an older person who is giving a great deal of money away in a manner that's very inconsistent to their private giving, should that prosecutor be suspicious? And if yes, what would you suggest being the next steps a person could take?
That would be of great concern. Anytime there's a sudden shift of patterns of financial giving, it really demands, I think, closer looking. This can happen in terms of actual transposition of cash from one person to another. Sometimes it's a will that suddenly dramatically changes the distribution of the will. Attorneys, not just prosecutors, need to be suspicious of that kind of activity and really look to explore why, what was going on behind that. I think it's important for them to explore who is impacted positively by the change, who got the money, and also who is impacted negatively in the transactions. It is very suspicious. Older adults do not generally tend to suddenly change their lifestyle. The case I have in mind was a lady who always wrote the $10 birthday check, even though she had $1 million, to each of her nieces and nephews. And when she suddenly was giving $100,000 to one niece, there was great suspicion. And in fact, it was eventually successfully prosecuted elder financial exploitation case. There can be situations in which something dramatically has happened and there is true desire to change. But I think what has to happen then is an assessment of this person's capacity. Increasingly, civil attorneys and probate attorneys are asking for prior assessments, even before it gets to the prosecutor. Did this person understand what they're doing in changing the will? This gift we wish to make, and we'll have someone like a geriatric psychiatrist, a psychologist, a geriatric internist assess. And depending upon the level of concern, that could be a clinical interview. It could also lead to detailed neuropsychological testing, which is essentially a 3-hour battery looking at subtle changes. For large estates, I've been asked to do this on occasion, especially when the attorneys have a sense that I'm writing a will, I'm writing a contract that likely will be challenged one day. I will tell you, as an expert in this area, there are times in which that attorney never does write that will or that contract because it's very clear that there was undue influence, pressure, various things going on that were illicit. The prosecutor has to be aware that that could have happened and really has to monitor what motives would people have. So it is just, the diversion of money should be a big bell that signals that there should be an investigation. The prosecutor themselves could have that person interviewed by a psychiatrist, geriatric psychiatrist, internist. But if it's an internist or geriatrician, they need to have expertise in understanding mental health issues, depression, anxiety, as well as cognitive issues, and the ability to integrate family findings, because those often come to play on this kind of decision.
Karen's interview.
Can you determine someone's capacity a year ago or 2 years ago? Is that possible?
It is possible. It is tricky because you need to have enough information from reliable sources of what that person's functioning was at that point in time. So these would be anyone from their doctor to a caregiver to a family member, preferably not the person that was accused of exploiting them, but someone that can say what their degree of functioning was at that point in time.
we very commonly are asked to look retrospectively at somebody's capacity. Could be potentially someone who has since died after an event happened. And therefore, since I don't have a client in front of me, a patient in front of me, I really need to have medical records or other information. That could be prior testimony or deposition testimony from family members, sworn depositions. It could be medical records around the time, prior emotional psychiatric records, criminal records, APS reports, anything that would come to bear on the issue, and again, targeted to a point in time, because most decisions or most actions happen at a particular point. So I want as much information as I can about those prior events. And absolutely, it is possible to render an opinion. Not always, however. There are situations where the record is just devoid of the kind of information we need to make the decision. And it's important for us to not make decisions if we don't have the information. But too often people fail to attempt to reconstruct, and they need to try because we can make those determinations. We know, for instance, the course of an illness, what time frames things happen in, whether it would likely be fluctuant or steady. And so the expertise of a geriatric psychiatrist can be brought to bear on retrospectively looking back.
Logos appear. NCAL, www.ncall.us. Terra Nova Films, terranova.org. Funded by the U.S. Department of Justice Elder Abuse Initiative and the Office on Violence Against Women, www.justice.gov/elderjustice.